Hi everyone, welcome back. My name is Bhagyashri. I'm one of the musculoskeletal practitioner in primary care practice. Today we have Dr. Sahadev Swain. He's a lead GP in Luton. And fortunately, we both work in primary care practice, and he is one of the first few people who have completed his second dose of Pfizer vaccination. And I have started being a vaccinator yesterday. So we would like to discuss a few aspects of this, his experience and my experience, because there's a lot of information floating around social media, in news, and people are panicked. And there's so many people who have reached and asked me about questions. So that's why we thought we'll make this video so that we can convey the most vital information. So welcome, Dr. Swine. Could you talk a brief about yourself and let everyone know about your experience of taking the Pfizer dose?
Oh, hello, Bhagyasri, and hello, viewers. Greetings to you all. Yes, as Bhagyasri said, I am a general practitioner in Luton near London. And yes, I consider myself very fortunate to have received the two doses of Pfizer vaccine recently in the interval of 2 weeks. And I'm pleased to say that in the first time, I had no a reaction at all. But although in the second time, I had some pain at the site of injection, but I did not take any medication or paracetamol or anything like that. However, I have heard some of my colleagues would have to go off work next day when they were injected with some pain or flu-like symptoms like pain all over the body, not feeling well for about 24 hours, but it all kind of disappeared with use of paracetamol and with the use of time. So luckily, there was no major adverse side effects.
That's quite reassuring to hear. So, Dr. Swai, from your experience, you mentioned a few people got flu-like symptoms. What does flu-like symptom consist of, and when someone should worry? In your experience, do you know any other adverse effect that the people have suffered post-vaccination?
Yeah, I'm going to answer you that question, but I will answer that in a broader sense because there's a lot of anxiety about the side effects of these vaccinations.
Right.
Luckily, the very adverse reactions are very rare. And most common reactions are, as I said, the pain at the injection site or some redness. The other one is systemic side effects, like the flu-like symptoms, which were, imagine when you had flu, your whole body is aching, and there's a runny nose, sore throat, tiredness, those sort of symptoms for a few days. In the same way, you could have, because this is also a viral, almost like an artificial viral infection, so you could have those symptoms. In the initial part of the introduction of the immunization program, we know, of course, we are proud that it started in UK, that two of the healthcare workers with severe allergy had anaphylactic reaction, but luckily that was managed properly. And, uh, and therefore the guideline was quickly changed that people with severe allergy should not be vaccinated. However, there has been recent changes in the guideline further that only people who have got allergy to the components of the vaccine should be like the vaccination is contraindicated. So otherwise others can have them. I want to add here that everybody who is given a vaccination is observed at the vaccination center for 15 minutes before actually they are allowed to leave the place. I'm sure you had the similar experience yesterday. If you
Yeah.
want to discuss that bit more.
Sure. I think, yeah, you're absolutely right. So yesterday when I was involved in the vaccine clinic, I've probably vaccinated more than 40, 50 people. So in the questionnaire, so before they come in, they fill a questionnaire and we ask them some clinical questions, whether they had any anaphylactic reaction or any severe allergic reaction in the past, and whether they're taking some adrenaline, they had to take adrenaline shot in the past, or they carry EpiPen. So these are the quite common questions that we asked, apart from a few other questions which I'll discuss. So yeah, that's key. That if they had such history, then we do not. It's contraindicated. The other questions were whether they're acutely unwell. If somebody has fever, somebody is suffering from COVID. This is very important because I suffered from COVID 3 weeks back, so I'm not eligible to take Pfizer. Because if you're acutely unwell or you have the COVID infection recently, which is within the 4 weeks time period, a Pfizer vaccine is contraindicated. Also, if somebody had the flu injection in last 1 week, then they should not take Pfizer vaccine as well. The other thing, important thing I want to mention here is warfarin. If somebody who's got history of coagulant they're an anticoagulant or blood thinners, or they've got coagulation issue, and their coagulating factor is not in control. It's if somebody is stable, they're in warfarin, but it's stable. They have had a recent blood test which reveals nothing to worry about. Then they can have it. But somebody who's got fluctuating warfarin levels, they did not have a recent blood test and lasted for 1 year, we do not tend to give them the vaccination unless that component is cleared. Um, Regarding the 15 minutes time, you're absolutely right, Dr. Swine. Yesterday, after the vaccination, we wanted to make them wait in the waiting hall. We used to paste a sticker on their jacket to know that at what time they should be leaving the clinic. And this is to check really any immediate response, because with the allergic response, we all know that you can develop skin rashes, you can develop purple lips, you can have intense swelling immediately. So that's all been taken care of. Is there any other vital point, Dr. Swine, you wanted to add here, which probably help all of our listeners to reduce the level of panic which is going around regarding the vaccine?
Yeah, I know there are a lot of information and misinformation around. Well, you could imagine I got long years of experience in the medicine. The fact that I have taken it, it should say something. If I want to add, my wife also was vaccinated yesterday.
Amazing.
And so therefore, I cannot say that you must take it, but you should consider it. Yes, the long term, if a very long term effect, we don't know. Nobody knows. So
Absolutely.
therefore, there is a scope for speculation. Imagine this disease is new, and the experiment is also new. But the
Yeah,
good news is we are all going to be monitored very carefully, at least in this country, so we will know everything that is related to it. But what is the
perfect.
choice? If you done nothing, what is happening in and
Yeah,
around London now, our hospitals are overwhelmed with the people who are wanting to be admitted to the hospital. So if you do nothing, then you could imagine a scenario almost half of us will be either
absolutely.
suffering from
Yeah,
it or
yeah,
will be debilitated, if not dead. So in that situation, the common sense should be applied, that
yeah,
this is one of the rare hopes that we have in 2021 for the whole world. Therefore, I sincerely say or request that yes, if you have your vaccination is accredited or permitted in your country, please do go for it. Save yourself and save your colleagues or the nation. And I really feel so fortunate. And in fact, I think within 4 weeks of my full vaccination, my effectiveness is more than 90%. And that is a great sense of security
yeah,
compared to what has happened to my life. I'm working from home.
fantastic.
Almost in other words, I'm hiding from everybody else as much as I love to meet people to to keep myself safe. I think that is a tremendous sense of freedom. I think I wish everybody should actually experience,
Absolutely.
although we still have to take the precautions like we have doing now even after that, because what we do not know, even if we may not get the disease, whether we will be transmitting, particularly being a healthcare worker,
Exactly.
transmitting from one to the other. So we will still be taking those universal precautions that we have learned so far.
Absolutely. That's a really good point. I think even after vaccination, we still have to unfortunately follow the same guidelines. Just one more thing I wanted to add here, Dr. Sai. Would you like to just tell about your past medical history? We just wanted to know because there's a lot of misinformation going around. If I'm diabetic, if I've got high blood pressure, can I take it? So, if you don't mind, can you?
Uh, yes, I think this is a revelation of the self thing, which I'm not scared to do. Yes, I am diabetic. For a long time, I'm on insulin. I also was recently investigated for a chest-related conditions, and I have been treated for it. So that puts me very vulnerable, and therefore I was asked to stay at home. So, but I think people have got kind of concerns whether I will be protected or not. If at all, actually, my group of people should be fairly top in the priority after the age. Age is the most important risk factor, 80 and above, and people who are in the homes, they are carers, and then the frontline healthcare workers, they are priority. But after that, the most vulnerable people and other age groups. In that way, I think it's quite clearly, and the guidelines are quite clear on that. So we should follow that and make everybody safe.
Perfect. Thank you very much. I'm sure this will be quite helpful for a lot of people. It hopefully answers many questions. If you have any other question, you can post your question in the below in the drop down box. Thank you. Bye.
Thank you, Bhagasri, for bringing this. Thank